Title: The Impact of Painkillers on Renal Health. In contemporary healthcare, the utilization of analgesic medications is pivotal for managing pain. However, discussions concerning their detrimental effects on renal functions have sparked pervasive debate and necessitate scholarly examination. Analgesic drugs are primarily categorized into nonsteroidal anti-inflammatory drugs, NSAIDs, and opioids. These medications operate differently within the human body, but a fundamental understanding necessitates examining how they may contribute to renal impairment. 1. NSAIDs and renal health. NSAIDs, such as ibuprofen and aspirin, work by inhibiting cyclooxygenase (COX) enzymes, which are instrumental in prostaglandin synthesis. Prostaglandins are hormones that support kidney function by affording vasodilation of the renal blood vessels. Prolonged consumption of NSAIDs impairs prostaglandin production, potentially diminishing renal perfusion, thereby escalating the risk for acute kidney injury, AKI, and chronic kidney disease, CKD. 2. Opioids and kidney function. While opioids primarily affect the central nervous system, their indirect impacts on renal function cannot be dismissed. Misuse of opioids can result in respiratory depression, leading to hypoxia, which impairs renal oxygenation and may contribute to renal injuries over time. 3. Dosage and duration. The renal risk associated with painkiller use is often correlated with dosage and duration of consumption. Transient use of these medications, when guided by medical advisement, rarely induces severe nephrotoxicity. However, the self-prescription or unsupervised prolonged use significantly escalates potential renal risks. 4. Individual susceptibility. Certain populations possess heightened vulnerability to analgesic-induced nephropathy. Individuals with pre-existent renal conditions, elderly patients, and those on concurrent nephrotoxic medications bear an increased risk profile for renal impairment when consuming painkillers. The correlation between analgesic use and renal impairment is contingent upon various factors including medication type, dosage, and individual patient circumstances. Healthcare providers emphasize moderation and advisement while prescribing such drugs to circumvent potential nephrotoxic consequences. Patients are urged to engage in regular consultation with healthcare professionals and operate under prescribed medical guidelines to mitigate renal risks intrinsic to analgesic use.